Almost 130 million Americans visit the ER every year, and many of them come in without any idea of what they should bring and what they are to expect. Today we hope to alleviate some of these concerns by giving you all the information you will need to have a successful visit, as well as some tips to make your experience go as smoothly as possible. Before we begin, this video will be covering three main topics. First, what patients should bring with them to the ER. Second, what patients can expect from a visit to the ER. And finally, some simple tricks and information to help disprove some of your misconceptions about emergency care. Let's start with what you'll be bringing with you to a visit. The most important thing you will need with you is a complete medical history, including your surgical and non-surgical procedures. This also includes family history of any diseases, along with a complete list of your diagnosed chronic issues. This information does not have to be memorized, but can instead be recorded either on a piece of paper or on a medical history app on your phone. Next up, you will need to have a complete list of all your current medications, including the dosage amounts and how many times a day you are taking the medicine. This again can either be memorized or recorded elsewhere. Some patients also opt to bring their individual pill bottles with them to their visit, and some pharmacies will even give printouts of all your medications if you ask. Continuing on, you will need to bring a list of all your medical and non-medical allergies, including things such as latex, certain antibiotics, and food allergies. Finally, it is essential that you bring any legal documents such as an advance directive or medical power of attorney, as these will help determine your course of care in case of an unexpected emergency. These documents, as well as all of the other items on this list, should be accessible to at least one other family member or friend who can provide them in case you are not able to during the course of your visit. Next, let's talk about what you, the patient, can expect from your visit to the emergency room, as well as the basic timeline for your visit. Take note that these examples are based off of a simplified visit and may not be representative of your particular time in the emergency room. To begin, when you walk into the facility, you will be greeted at the front desk and be given some simple paperwork to fill out before you are seen. All this paperwork entails is your name, social security number, and date of birth. No insurance information will be taken at this time. This is also when you will tell the staff what your main complaint is or why you are visiting the ER today. Make sure to be specific with this information. After this paperwork is completed, a nurse will come to take you back into the hospital where your vital signs, weight, and height will be recorded. The nurse will also ask you about your complete medical history and to elaborate on your complaint for the day. Next, the doctor will come in and give you a thorough examination based on your complaint. This examination will allow the doctor to determine your next course of action, which will vary greatly patient to patient. After this examination, you may be required to undergo more tests to ensure a proper diagnosis, or the doctor may be able to give you one right away. Either way, after a diagnosis has been made, you will be given the appropriate treatment based on your condition and will be either discharged or transferred to another location for further treatment. If you require overnight observation or any other non-emergency treatment, you may be admitted into the inpatient wing at your current location or transferred to another location for inpatient care. Finally, when you are discharged, a nurse will come by with a packet detailing your final diagnosis, your discharge instructions complete with specialist referrals or home care procedures, and lastly, any prescriptions you will be needing. This is also when any final medical questions may be asked before leaving. Finally, let's discuss some of the common misconceptions that patients have about the ER, as well as some tips to make sure your visit runs as smoothly as possible. First, let's discuss some important insurance information that you, the patient, should know regarding emergency care. When going to an emergency room, it is required by law that you are screened and evaluated before any insurance information is taken. This means that no matter what, you will be seen and given a diagnosis, but you still must remember that emergency care can be costly, and this does not make these procedures free. In fact, insurance companies require different copays and have different rates for emergency departments, primary care facilities, and specialists. Patients must become educated on their own policy in order to make the best decision regarding their own health care. Next, patients should realize that doctors may ask certain questions that are uncomfortable, but they should always remember that these questions are in their best interest. Certain topics such as safety at home and with family, as well as psychiatric history, must be discussed in order to make a complete diagnosis, and patients should never be offended by any of these topics. Lastly, patients need to realize what an emergency is and isn't, and when they should seek emergency care over going to a primary physician or a clinic. The emergency staff will never discount anyone or their symptoms and will always give you a thorough examination along with a diagnosis, but you should respect the opinion of your doctor if they tell you they do not believe you require emergency care at the moment. it is essential that patients remember that emergency rooms are not the only option they have for their health care. Visiting a primary care doctor, clinic, or other specialist may be more beneficial in the long run for more chronic issues. The emergency room is there for the immediate emergencies. Now, that is not to say that only conditions such as heart attacks and strokes require an emergency room. Everything from excessive diarrhea, dehydration from vomiting, excessive fevers, infections, and various injuries such as broken bones can be a threat to your immediate health. All of this will relate back to your individual medical history and will vary on a case-by-case basis. This is also why emergency rooms can never give an accurate diagnosis on the phone and will always require patients to come in for an examination in person. Now you have all the information you will need to have a successful visit to the ER, and we hope that this video has helped you in some way. Please help spread awareness by sharing this video or information with your friends and family. Either way, thank you for watching.